Come in.
Hello.
Hi.
Hi, how are you?
Good, how are you?
I'm doing good. My name is Wendy. I'm a Winston-Salem State University student. I'm in the RN-BSN program. Today, I'm here to assess your thorax and lungs. Is that all right with you?
Mm-hmm.
Is it also all right with you if we record this today?
Mm-hmm.
Okay, great. And can I get your name and date of birth?
Tammy Smith, 7/18/83.
And what would you like to be called, Miss Smith or Tammy?
Tammy, please.
Okay, great, Tammy. Well, before we get started, I'm going to go wash my hands. There's a few vitals that I need to get. I'm going to be asking you a couple of questions in the meantime, and then we'll get started on the actual exam.
Okay.
Great. All right, Tammy, I see that the girls out front, they went ahead and got your height and weight, and you're 5'4", 132 pounds. Is that correct? Great. Do you have any allergies?
No.
Do you have any heart problems, any lung issues? Do you get coughs, colds often?
No.
Are you coughing in the middle of the night, anything like that?
No.
Okay. Are you able to walk up a flight of stairs without getting short of breath?
Yes.
All right. Is there anything that you need to tell me that you're having problems with at all today?
No.
Okay. I'm going to go ahead and start with your vitals here. I'm going to get your blood pressure. This might get a little bit tight around your arm.
Okay.
But then it should go away in just a few minutes. Okay, we got 122/62. Is that about what you normally run?
Mm-hmm.
Okay. I'm going to get your temperature as well as your heart rate and your O2 level, which measures your oxygen in your body, all right?
Okay.
I'm just going to set that on your finger here. Okay, we got 98.4. Your heart rate's 94 and your O2 level is 98%. Okay, Tammy, I'm just going to explain a few things before I get started. Today I'm going to be doing a couple tests on your posterior, which is your backside, as well as your anterior. On the anterior, I'm just going to be listening to for today's purpose, but in a complete assessment, we'd be doing both of these on the anterior and posterior side, okay? The first I'm going to start off with just inspecting I'm going to inspect both anterior and posterior. And then on your posterior side, I'm going to do a couple of palpation exams, and then I'm going to percuss, and then I'm going to listen to your front side. Okay? All right, I'm going to go ahead and ask you to just kind of swing your legs over that way for me. Okay. And I'm just looking here, just try to be normal, try to act normal. And take a deep breath in for me, and out. Good. All right. And I'm just going to feel, is any of this feel tender at all, Tammy?
No, ma'am.
Okay, all right. Well, first what I want to do is I want to be testing for symmetrical expansion, symmetrical expansion, and this is just expansion of your chest wall, okay?
Okay.
So what I'm going to do is I'm just going to place my fingers right here along your T9 area. And then Tammy, I'm going to pinch up, and when I'm going to ask you to take a deep breath for me,
Okay.
and then you'll exhale, okay?
Okay.
So let me just pinch up a little bit first. Okay, and go ahead and take a deep breath. Good. And your thumbs fall downward and apart, which is a normal sign. You're symmetrical on both sides, so that's good. And on the anterior, when you're doing this, you would start at the xiphoid process on the anterior side. Okay, Tammy. So now I'm just going to do a percussion. I'm going to do palpate, and it's called tactile firmness, and it tests for vibration. And there's 5 areas that I'm going to be doing that too, okay?
Okay.
All right, and then I'm going to be placing my palm on your hand, and I'm going to have you repeat the word 99 for me.
Okay.
Okay? Go ahead.
99, 99, 99, 99, 99, 99, 99, 99.
Great, all right, and all that checks out, both symmetrical, feel the vibration on all fields. Next, I'm going to be percussing, Tammy, and I'm just going to be taking my finger here, and I'm going to be tapping along some 9 areas on your posterior side, all right?
Okay.
Okay. And then this part of the exam, you want to make sure that you go in between the interspaces and not on the rib cage, you can feel more down here, so just be careful doing that. Because again, it can give you a different sound. And this is tested for residents, okay?
Okay.
All right, and then I'm gonna start high on this one. All right. Is that pressure okay for you, Tammy?
Yes.
All right, and all that checks out as well. Okay, great. Next, what I'm going to be doing, Tammy, is the one last percussion test here. It's called diaphragmatic excursion, and I'm going to be tapping just like I was before on exhale and inhale, and I'm going to be marking a couple of areas, okay?
Okay.
All right, so first I just want you to go ahead and just exhale for me. I'm going to start up here again. And this is just testing once I hear a different dull sound. I'm going to be marking. All right, great. Go ahead and just relax and take a couple of breaths. So normally I would mark with a piece of tape or a pen right here. And then I'm going to ask Miss Tammy to inhale for me and hold. And then I'm going to be marking until I hear a different sound. All right, go ahead and just take a couple deep breaths. So from here to here is about 3 centimeters, and that's what you want, 3 to 5 centimeters. On athletes, it can be about 7 to 8 centimeters. Anything less than that can represent some issues going on in the lungs. All right, and you checked out good?
Okay.
Okay, I'm gonna go ahead and have you swing forward for me. Okay, I'm gonna go ahead and listen to you here.
Okay.
And there's 5 fields that we're gonna be listening to today, okay?
Okay.
And if you need to take any kind of breaths between and just relax, just let me know.
Okay.
And normally I would be listening under the skin and not over the clothes, because you get a better sound when listening skin to scope. And you always want to make sure that you warm your scope up before touching the patient, as well as clean it in between. Okay. All right, Tanya, go ahead and take a deep breath. In and out. Good. Just here, and one from here. Good. Okay, Tammy, your lungs are clear. Everything looks good. You have normal vibration, normal palpitation. You have normal resonance on percussion. Your diaphragm looks good, feels good, and symmetrically in all areas. Anything that would be abnormal as far as crackles, wheezes, anything like that, or if any of your posterior exam was not symmetrical, it could represent emphysema, pneumonia, or something going on in the lungs where if other testing might need to be done. Okay? All right, well, thank you so much for coming in and letting me do this assessment on you today. Is there anything else I can do for you?
No.
All right, great. Thank you so much, and have a good day.
You too.